allowing you to really rise forward.
Oof, that one really hurt my back.
2 weeks later.
Hello? Thanks, Sam. Send her in. Hi, Emily. Great to see you
Hi, Dr.
again.
Smith. Nice to see you.
Please sit down.
Thanks.
Hey, Emily. So how's college going?
It's going really well. So as you know, I'm a diver at school. So I've been diving a lot, and unfortunately I'm only home for a week for Christmas break, and then I have to go back to my training.
Okay. So what brings you in here today?
My back's really been bothering me a lot. It's in a lot of pain. Sometimes it keeps me up at night.
Interesting. Can you describe the pain a little bit more? Like, did it come suddenly or gradually?
So it started while I was at practice almost 2 weeks ago, so it came on pretty suddenly, I guess. And then it's like pretty sharp towards my spine and then kind of radiates outward.
Interesting. I'm gonna take a look. Alright, push out on me. And now resist the pull. Alright, perfect. Alright, same thing as before. Push out on me. And now resist the pull. And now scrape your heel along your shin. Alright, perfect. Thank you. So everything looks normal upon examination, but do you have any numbness or weakness in your arms or legs?
No, nothing like that.
Okay. Well, I think I'm just gonna prescribe an x-ray then and start you on some anti-inflammatories to take care of the swelling.
Okay. So actually with the x-ray, I was talking to my coach. You know, he has a lot of experience with athletes and back injuries, and he wanted to see if I could get an MRI done because he knows that sometimes the injuries show up better on the MRI scan than the x-ray. Would it be possible to get that done?
I don't really think your case calls for an MRI. Also, the insurance might not cover an MRI, so you'd probably have to pay for it out of pocket.
Geez, MRIs are really expensive, aren't they? I can't afford that. It's just that because I'm going back to school on Monday to get back to diving, I just would really want to know if something was wrong, which is just why I really want to get an MRI.
Okay, let me see what I can do. I want to make sure you're alright before you go back to school. Hey Joe, do you have a minute to talk?
Yeah, man, what's up?
So I have this patient, and she's a collegiate athlete, and she has back pain, so I recommended her to get a back x-ray.
Okay.
But the thing is, her coach really wants her to get an MRI to rule out certain injuries, but she doesn't have any nerve deficits like numbness or weakness in her arms or legs. So the insurance company is not going to cover an MRI at all, so I really don't know what to do.
So what do you think?
Well, I mean, it won't hurt the insurance company if I deceive them and say she has nerve deficits, so they'll cover the MRI, and it will really benefit my patient,
So you want to lie? That's a slippery slope there, buddy.
Well, not lie per se, just kind of exaggerate some symptoms so my patient gets the best care.
Well, I would not recommend you do that, Matt. Did you not learn anything from the Kant lecture in our bioethics class? According to the principle of universalizability, you would have to be okay with all physicians lying on behalf of their patients and exaggerating their symptoms to get better treatment. That would drive costs up for everyone. There are reasons protocols are in place.
But insurance is a $1 trillion industry that makes all their money on withholding treatments and tests from their patients anyway.
Well, let's see if we can find a way to get excellent care for your patient without lying. For example, I think protocol recommends that an MRI be done if there is nothing shown on the x-ray but pain still persists. So I think that would be a good way to do so, to give care without lying. Why don't we see if there's a physician, an orthopedist at Brown that can help her out?
Oh, that's a great idea. And maybe I can continue to follow her care throughout that too.
Sounds good.
Hello? Is this the orthopedics clinic at Brown University? Okay, I'm calling on behalf of one of my patients. She's actually a student athlete there, and she has some pretty persistent back pain. And I was wondering if you could see her sometime next week. All right, perfect. Thank you.
A few moments later.
Hey Emily, so I have some updates for you. So I think I found a treatment plan that's going to work.
That's great.
So I'm gonna have you get the x-ray today, but I've been in contact with an orthopedist up in Rhode Island. So if the x-ray comes back negative and you continue to have pain, they're gonna order you an MRI.
Okay.
But I've told them to send all your files back here so I can continue to monitor your pain.
Okay. So if I get the MRI later after I've already had the x-ray, will the insurance cover it?
Yes, they will.
Okay, that sounds great. Thank you so much, Dr. Smith. You always go above and beyond for me.
No problem.